Hi, it's Bill, the knee pain guru. Welcome to today's video presentation. Today we're going to talk about the top 5 reasons why knee replacements fail. We'll be answering questions in a little bit. So if you do have questions, please put those in the comment section and I will address those after the short presentation. Also, give the video a thumbs up, like and subscribe to my channel, as well as turn on notifications for future videos. I do these twice per week. And I use the content of those questions and comments for future videos, for topics for future videos. So participate. That's the way it's really going to help a lot. Okay, the top 5 reasons why knee replacements fail. Now, this was taken from an article written by 2 doctors, a Dr. Amar S. Ranawat and a Dr. Morteza Mefta, and I hope I pronounced that correctly. This is from the website Hospital of Special Surgery, I believe. Hospital of Special Surgery. Okay, so this is the content that was taken from the website. And it'll help you understand. I just as a prerequisite, or just as establish manage your expectations here. It's important. Like, doctors play an important role. I don't want this to come across as anti-doctor, because it's not. But we need to look at all of what's going on here, and the more information can be helpful at times. It can be confusing. But when we distill it to understand what is going to be best for you and what's going on with you and your knees, most of the time people go for a knee replacement surgery because they feel they don't have any other options. And they felt like they haven't had any other options for a long period of time, getting to a place where it's like, okay, doc, let's just go ahead with the surgery. Understanding the magnitude of what's going to happen with a knee replacement surgery is going to be helpful in determining whether a knee replacement surgery is for you. I have martial arts buddies that were never told their knee will not bend past 90 degrees. Now they're trying to do martial arts after the knee replacement surgery, thinking it was going to fix their issue, and they're pretty frustrated and honestly pissed off at the doctors. However, let's go over the top 5 reasons why knee replacements fail. Number 5, patient-related factors. And they talk about age, activity level, surgical history, and weight can contribute to the implant failing. This is one of the reasons, this factor is one of the reasons why doctors wait till you're old enough to have a knee replacement surgery, is they want to try to mitigate this factor. The fact that younger people are generally more active than older people, what they want to do, which contributes to the failure of the implant, is they want to wait until you're old enough to have a knee replacement surgery. And the reason being is the replacements are only rated for 15 to 20 years. The plastic and metal that they use when they cut off the bones in your leg, drill a screw down the length of the bone to stabilize this new plastic and metal joint. This is now in your leg. This now becomes your knee. And when you're younger, you're going to still want to be active with this plastic and metal in your knee. And the more you use it, the more the joint wears, and the more what happens is the screw has, it takes a toll on the bone. So they call it patient-related factors as far as activity level, your age. Of course, younger, you're going to have a higher activity level. Surgical history, which if you've had lots of surgeries or whatever has been going on, can also contribute to what's going on. And weight. Of course, the more weight you have, there's 4 pounds of force on the knee joint every time you step for every pound overweight you are. So that plays a role in the patient-related factors. That is reason number 5, the most common reasons why knee joint replacements fail. Number 4, instability. That happens when there's not enough strength in the leg, the muscles. When they are replacing the joint, they're taking out tendons and ligaments that hold the joint together, and you essentially have this plastic and metal joint that is now comprising your knee joint. That can create instability when you're walking. The knee can slide, then it can give way. There's issues with that. So that's when whatever is left in the knee isn't able to support the knee replacement once the knee replacement has been put in. So there's instability issues. So that is reason number 4, the most common reasons why knee replacements fail. Number 3, and it's number 3 they're referring to as fractures. Now, fractures is going to tie in with kind of the age and the activity level. The more you use it, the more the chance is that the bone can fracture. Because once again, they are now drilling down the length of your bone with a screw that's stabilizing the plastic and metal that they're replacing your knee joint with. So the bone can splinter, the bone can fracture. And then depending on the type and the extent of the fracture can determine whether or not they can actually fix what's going on. So other things to take into consideration. That is number 3 reason why the knee replacements fail is fractures. Number 2, I got a horror story for this one. Infection. This is rough. This is what happens when you're in a hospital. Anytime you're opening up the body, there's the ability for viruses and bacteria to get inside of your body and cause issues. There is the risk of infection when that happens. And now they've opened up your legs. They've sawn off the bones, putting the plastic and metal in there as a replacement knee, the knee replacement. They're drilling down the length of your bones to stabilize this plastic and metal in place. And you have all sorts of an ability for infection because now you've opened up the body to the outside, the world that has lots of viruses and bacteria, and our skin is there to protect, to keep that from getting inside, getting infected. Like in a wound, you cut your finger, same deal. You want to put an antibiotic in it and you want to cover it with a Band-Aid until it heals so your body is protected. Now you have this huge open wound essentially that is created by the knee replacement surgery. And one of the stories that I had a client who was a chiropractor, and he was telling me one of his patients came in and was telling him how this chiropractor was going to need a knee replacement because he was having issues and he was limping. Him and I were working together. He was seeing improvement. The chiropractor was saying, no, I'll pass. This guy had just gotten done with a knee replacement surgery, double knee replacement. And within a day or so, this man, this chiropractor's patient was rushed to the hospital and had to have an emergency surgery to remove the knee replacements. He was having all sorts of symptoms of systemic infection in his body, and they had to remove the knee replacements. Well, this man laid in a hospital bed for 5 months without knees. 5 months without knees because he contracted MRSA in the bone. Now, the doctors in this article, in which, by the way, I will leave the link to this article in the comments section, they will say that there's less than 1% of people who have knee replacements that will have an issue with infection. Then you go back to the numbers that they say there's over 581,000 knee replacements done in the US alone every year. Well, if you do the numbers on that, you do on the math, there's approximately 5,800 people who suffer with infections in the knee after a knee replacement surgery. If that's the path that you want to go down, choose wisely. Just it's important to understand this, to understand the numbers and understand what they're really saying, because a lot of times when they write this stuff, and you can see it on the website, they'll package it and make it in a really nice bundle and sound like a wonderful thing, and the quality of life improves and they're successful and they get excellent results. But then if you look at what a knee replacement feels like, my father had one, laid himself out in my living room because he couldn't squat down enough to pick up something off the floor. Then you break a hip and you end up in a nursing home. But that's another story. Okay, number one reason why knee replacement surgeries fail or knee replacements fail is wear and loosening, which kind of sounds like number 3 and number 5 in a way. The wear and loosening, what happens is as you're walking, things get loose. This is not your normal body anymore. They have replaced your body with something that is foreign. It's not normal to have plastic and metal inside comprising your knee joint. So there's wearing and loosening that takes place. The screw can begin to loosen. The joint may be not lined correctly and cause the joint to jiggle. And the Western medical model will say, well, the new technology and the this and the that is great. It's great. I think the technology is phenomenal. But in terms of if you want to have full flexibility and mobility in your joint, is this what you really want to do? And are there other options? Are there other options besides the pain management that the Western medical model has to offer? Maybe, maybe not. You have to do your research. But those are the 5 reasons why knee replacements fail. So the first one, patient-related factors, instability, fractures, infection, and wear and loosening. So that is the end of my presentation. If you have questions, please put those in the comments section over on the side. You have questions about doctors, pain, knee pain, physical therapy, your diagnosis, whatever you're dealing with, we can go over and deal with some things. And we have our doctor from the UK. Loss of risks of surgery, like Bill says. Surgeons are now doing partial replacements and implants improving. Yes, I would agree. I'm curious if you have any documentation. There was a few years ago when they were, and this is a little bit off topic, but there was a clotting. It was like a sponge that was infused with stem cells and some other things. I believe it was a doctor or a technique that was discovered in Switzerland about reattaching ligaments after a complete rupture. And they did something where they threaded the ligament, they threaded the sponge, they drilled a hole in the bone, and then the clotting mechanism that was infused with stem cells had an ability to reattach the ligament to the bone. If you have any information on that, I haven't been able to find that anywhere since I saw the video. If you know any information on that, that would be extremely helpful. Rehab and lifestyle changes are the best way to go. I would agree. And I'm going to, well, doctor over here is an osteopath, and my whole training was based on osteopathic principles. So I am an in very much alignment with what the doctor is sharing here. If anyone else has questions about knee replacements, pain, diagnosis, doctors, physical therapists, whatever the situation is, please enter that in the comments section over on the side, and we will address those. And we have a doctor here as well, which sounds like he's willing to contribute to his perspective, which I find unique. He brings a unique skill set to the table, which I think is phenomenal. And maybe not. Regenerative medicine is a game changer. And how would you describe regenerative medicine? Like, how is regenerative medicine different than other types of medicine? Because I think what happens is there's a disconnect between doctors and those that are experiencing pain. And they're a person in pain, and I've worked closely with many of them, is that they're trying to make sense. They just want to be out of pain, and they're trying to make sense of these words that are being given to them. They're trying to make sense of the diagnosis that's going on. They want an actionable thing that they can do. And then doctors very much have it's a different language. Essentially, it's a different language that this person that's in pain is trying to translate the language that's being said, very much like attorneys. Attorneys will have certain terms, like what is the definition of is? And what ends up happening is the person in pain just wants to be out of pain, and they don't care how they get there. So they will trust in what the doctor is saying to get them out of pain. Regenerative medicine is a game changer. Prolozone injections and prolotherapy can help. Prolozone injections are regenerative medicine. And going back to the initial question that I asked, how is regenerative, like what are the other types of medicine? Like what types of medicine that a person would look at, and they're going to go to the doctor and say, I want regenerative medicine. Well, how does the doctor know? Like the doctor would say, well, we don't do regenerative medicine here. Or this is just like regenerative medicine. And a person who doesn't know the terms is going to go, oh, well, it's just like regenerative medicine. Semantics make a difference. Understanding makes a difference. And the challenge is doctors aren't necessarily the ones that need to do the majority of the work. Like there needs to be like a platform of education from, oh, okay, cool. Working with nature, no steroid drugs. That's great. Right? But I think educating, the internet is a great tool in terms of educating someone in pain, which they don't necessarily want to have to go through all the hoops in order to get educated to make the decision that they need. So, human condition, we work with it. We do the best we can. We show up and try to help. Prolozone is oxygen injections. Oxygen heals tissue, stimulates new cartilage growth. Cool. Excellent. And if I am correct, and my studies would indicate that, you're talking about O3, ozone injections into the joint. And is there a difference between ozone and prolozone? Like, is the ozone injection just the fact that it's oxygenating the joint is going to promote the healing of the tissue, prolotherapy is only dextrose. I understand the prolotherapy, it's instigating a healing response from the injured area or the damaged area. Thank you, sir. Okay, looks like he's done. Anybody else have questions? Please enter those in the comments section over on the side, and I will address those. And if not, we will use, possibly do future videos on prolozone, prolotherapy. Yeah, that would be a good thing. Okay. Thank you so much for being here. This is Bill Paravano, the Knee Pain Guru, wishing you very well. Have a great day, and I will see you on the next video.